Good morning. Happy Tuesday. How is everybody doing today? I am Jenny Gallagher with Joyful Heart Healthcare. And I thought the glare wasn't that bad, but oh, wait, sit like that, it's not so bad. So, good morning. How is everybody doing today? I can't look like that forever. Is that any better? Yeah, that's better. Good morning. That's going to drive me nuts. Give me 1 second. Got to put up a different shade. That's better. Less glare on my glasses. So, sorry about that. I thought the glare was not so bad until I actually went live. The view before live wasn't as bad as once I'm live. So, good morning, y'all. Sorry about the technical difficulties, but I'm Jenny Gallagher with Joyful Heart Healthcare and Keto Nurses. And it's Tuesday morning, coffee with Jen. And I've barely gotten started this morning. I don't know where the time is gone. Like, I did my quiet time, I got ready, and then it's time to be with y'all. So I haven't had much coffee this morning. So we're going to talk about what conditions keto is helpful for today. We've been talking about getting started. We've done 3 or 4 sessions on getting started and some things that are important to understand when you get started using low carb or keto grain-free eating. Some great tips and information in the previous sessions, but the last couple of weeks I've had quite a few patients and or just general conversations with people, and they're like, well, what kinds of things does keto help? Like, what kinds of conditions? So I thought, great topic. I've never really talked about that before. So that's what our conversation is about today. So good morning. Good morning. If you have a question about a condition that you wondered if keto might help or worsen, type it in the chat and we'll discuss it. So the first question I have for y'all, get your typing fingers ready. The first question I have for you, who knows what keto eating was first used for? What was the first utilization of ketogenic eating? Who knows what that was? What was the very first utilization of ketogenic eating? Who wants to take a guess at that? What was keto first used for? Any ideas? Who's got a guess? Oh, Cindy, Debbie, y'all are right on the money. It was used 100 years ago for epilepsy and seizures, especially in children or even adults who were not able to use medicine for improvement. Yes, there were a couple of medicines around back then, but some patients were not responsive to the meds or they had severe reactions to the meds. So it was trial and error, but diet was found to play an integral role in improving seizure activity. Seizures significantly dropped when carbs were eliminated and significantly reduced from these patients' diets. So when people say keto is a fad diet, you can say, well, it's a fad that's been around 100 years. Because ketogenic eating has been utilized for at least since the 1920s. It's actually our ancestral diet. And so some of you follow Dr. Ken Berry and his wife Nisha on social media. They talk about ancestral dieting, the proper human diet, as being what we ate hundreds of thousands of years ago. And that is true. you know, bison, all the wild game is what sustained us for thousands of years. That's how people lived. That's how people could eat once a week or once a month, even sometimes, hundreds of thousands of years ago, and not starve because they were fat adapted. So we eat way too often in our modern culture. So for people who are struggling with eating disorders and insulin problems, diabetes problems, various forms of metabolic problems, health conditions, ketogenic eating is a great way to reverse many of those symptoms and lab markers. And that's how it kind of came to be again, about 30-ish years ago. It became quite favorable to start using a ketogenic or low carb eating plan. The problem has been when mainstream diabetics and or mainstream prescribers hear the word keto, their first conception, their first alarm is that, oh my God, diabetic ketoacidosis, and they totally freak out and say it's dangerous, you can't do that. The problem is they're not understanding basic definitions. So diabetic ketoacidosis is a life-threatening condition associated with extremely elevated glucose levels. With the introduction of a certain class of diabetes drugs, we now have normal glucose levels with acidosis. That's not the same thing, but we are seeing a few instances of acidosis in the presence of normal glucose levels because of certain medications used for glucose management. So that does happen, and it's quite scary because the glucose had been originally a major marker of the acidosis, and now it's less noticeable. You used to have a really high glucose, 300-400, to even clue us in as prescribers that, oh, this might be an acidosis issue, and now that's not true. Now we have to get lots of other lab values to be able to see the acidosis. We have to look very carefully at the med list. We have to get a good history on a patient. If the patient is incoherent or unconscious, you don't know that information. So acidosis is a problem other than diabetic ketoacidosis, and so that presents issues. So that's usually the first problem when you start talking keto with people who are already familiar with diabetes and the DKA problem. So there is an article on my website, joyfulhearthousecalls.com, that discusses this differentiation in great detail. You can go to my website and download. You can even print that article if you want. It explains the difference in nutritional ketosis and diabetic ketoacidosis so that anyone that wants to understand the difference can understand that article quite easily. So that's the first obstacle a lot of people need to overcome when you first start talking about a ketogenic eating plan, because people freak out. They're like, oh, I can't do keto because I'm diabetic. Well, actually, keto is made for diabetics. People on insulin have to be extremely cautious using a low carb or keto eating plan because the combination of low carb and insulin causes a high risk of hypoglycemia that can pose severe hazards to health and life. So it does take a skilled prescriber to assist these patients to lower their insulin and or other medications they're using. It's not just something you start willy-nilly messing with. So you need a well-educated prescriber. If you can't find someone, then you need to reach out to someone like me, Dr. Berry, Dr. Westman. There are several low-carb experts I practice in a lot of states on my Facebook page, Joyful Heart Healthcare, on my Facebook page where you're watching now when you get done with this video. At the top, pinned to the top of my page, there's a graphic that lists the states I practice in. If I am not licensed in your state, then you can go to lowcarbusa.org and they have a prescriber finder. And so you can look in states other than where I am and find someone, or if you want to see somebody in person, if you don't want to do the telehealth thing to see me, you can find someone in your location that is knowledgeable and able to utilize appropriate guidance to help you reduce your medicine the right way. It's not okay to just stop your medicine and start low carbing. That is unsafe because your glucose can significantly jump high enough to contribute to diabetic ketoacidosis, and then your life really is in danger. So it really is a balance between medicine and low carbing for several weeks until you figure out what your body needs to help you be low carb more permanently. So, but diabetes is one of the first reasons to consider going low carb. Depending on the medicines you're on, you may not have to adjust many of them, but you need a prescriber's guidance to help you with that. If your local PCP, your local prescriber isn't knowledgeable, then find someone who is. It's really important that you get help and guidance because many of these medicines directly lower glucose, and that's exactly what low carb eating does. It directly lowers glucose. If you cut out carbs, there is no glucose left. If you are on medicine that lowers glucose, that poses a hazard, and your glucose level can fall into hazardous ranges like 18, 19, 20, and that can be fatal. So it is extremely unsafe to use low carb eating in the presence of diabetes medications. You need a knowledgeable prescriber and common sense to help you manage those medicines. Okay, that's a major warning. Other diseases and conditions include insulin resistance. I talk about insulin resistance on a lot of my videos. I have several videos about insulin resistance or about supplements you can use to help with insulin resistance. You can go to the Joyful Heart Healthcare page, scroll down the videos tab, and find boatloads of information about insulin and or insulin resistance. Insulin resistance is the other end of the spectrum. So you have a glucose problem or an insulin problem if you have metabolic dysfunction. Glucose is part of the problem, but insulin is the other part of the problem. And so sometimes you can have normal glucose, but really high insulin. That's a problem. Sometimes you can have high glucose and sort of normal insulin. That's a problem. So eventually you will have both high glucose and both high insulin. And that's when you wind up with a true diabetes diagnosis. That's not good. High glucose levels and high insulin levels are what trigger high inflammation and high risks for cardiovascular disease, heart attacks, and strokes. We don't want that happening. So that is one of the reasons my practice exists. I want people to understand that they can lower their risks for cardiovascular disease by going keto or low carb. What are some other conditions that you've wondered about keto being useful for? One of the, some of the most common other conditions include the autoimmune diseases. Grain intake significantly impacts inflammation. Inflammation drives poor health. So low carb or ketogenic eating plan is great for things that we see diagnosed all the time as autoimmune disease. Things like rheumatoid arthritis, lupus, psoriatic arthritis, Sjogren's, mixed connective tissue disease, all sorts of fibrosis conditions, PCOS is also related to the insulin resistance. A lot of infertility is related to PCOS and insulin resistance. They also benefit from keto or low carb eating plan. Endometriosis, PMS, PMDD also are related to insulin resistance and high glucose levels. So lots of conditions. The most famous question I get is, my doctor told me, my nurse practitioner told me I can't be keto because I have chronic kidney disease. That's the biggest myth out there, y'all. Chronic kidney disease responds very well, and there are studies to support what I'm saying. But chronic kidney disease responds really well to a therapeutic ketogenic eating plan. The problem is chronic kidney disease is almost always caused from the diabetes, the hypertension, the metabolic syndrome, the insulin resistance, the obesity, all the things you had for the last 20, 30, 40, 50 years caused the chronic kidney disease. If we reduce the carbs, we reduce the glucose, we reduce the insulin, we reduce the inflammation, kidney disease resolves. It's that simple. Some people will say, well, keto's high protein. No, it's not. A true therapeutic ketogenic eating plan is a moderate protein eating plan. It is not high protein. High protein might be hazardous to kidneys. So you want to be very cautious about what you say or believe about keto. There are a lot of beliefs about keto. There are a lot of voices about keto out there in the world. Many of them are different than what I teach. So be very careful who you listen to and what you believe about ketogenic eating. There are specific definitions. I have a graphic that I sometimes post on my social media. It's basically from the Low Carb USA clinical guidelines. I don't remember it exactly, but basically it says that compared to the standard American diet, 100 grams of carbohydrates is considered a low carb diet. When you consider that 250 to 300 grams a day is standard, 100 grams is low carb. I've had people mock that, but I didn't make that up. That's from Low Carb USA's guidelines. Okay. So then I think the next bracket down is like 50 or something. So 50 is considered very low carb, and then 30 is very, very low carb, and then 20 is considered therapeutic ketogenic. And then somebody added something about adding carnivore as zero carb. And so I've not added that to the graphic, but somebody commented that on one of my pages. So carnivore is actually very healthy. It is not dangerous to your health. There is no real reason to have fruits or vegetables in your diet if you don't want. I had a nurse practitioner message me a couple weeks ago, and said, what do you tell parents who are struggling to get their kids to eat vegetables? And I said, don't make them have it. She didn't answer me back. So it's a hard concept to wrap around our heads when we've been taught the 4 food groups that I grew up with, the pyramid that some of you grew up with, the My Plate that some of you grew up with, because all of that is mostly fruits and vegetables, and then a little bitty section for meat. So we think that fruits and vegetables are and should be the mainstay of our nutrients in our diet, but they really aren't, and they shouldn't be. Fruits and vegetables are all going to break down into carbohydrates. They are carbohydrates. They are going to break down into glucose. Many of them are going to break down into phytates, which block nutrient absorption and raise inflammation. So there isn't any real need to consume a boatload of fruits and vegetables. A few here and there are fine. You're not going to be crazy for eliminating most of them. You're not going to be crazy for having some. Okay? You can have fruits and vegetables in small quantities, but you need to understand where your carbs come from and where your inflammation comes from. That's the real key. Almost any condition that you have, if you have a labeled diagnosis, osteoarthritis, ankylosing spondylitis, herniated discs. Name something, y'all. Type in a diagnosis. You don't have to have it. Hypothyroidism, Hashimoto's, hyperthyroidism, Graves' disease. Like any diagnosis name you can think of is going to be benefited by eliminating grains and reducing carbs, because they're all driven by inflammation. Inflammation drives 99% of chronic disease. Therefore, chronic disease diagnoses are going to be improved when you get rid of inflammation. And the carbs and the grains are what drive inflammation. Does that help? Anybody have questions today? Y'all sure are being quiet today. I see all of y'all joining, and I am really thrilled y'all are here, but y'all are awful quiet today. Nobody's talking to me. I don't like that. I like it when you talk to me. Hi, Judy. I love it. All right. Well, this is another short. That's pretty much what I had to share today. This conversation is about diseases, conditions that respond well to a ketogenic or low carb or grain-free eating plan. So share this video, hit the little arrow and share it on your social media. Send it to someone in a private message if you want. So give it to somebody that you think would benefit. If you've been talking to your spouse, your child, your mom, your dad, whoever's struggling with understanding why their disease might improve, this little 20-minute video might just spark some help for them. So y'all have a great day. Keep sharing the content. We are up to a little over 3,000 followers, so I appreciate each one of you. But keep sharing, sharing, sharing. I love it. So I really appreciate your help. So I'm Jenny Gallagher with Joyful Heart Healthcare and Keto Nurses. I will see y'all next Tuesday with more shorts. Bye, y'all.